Hi, Tabili. Today's our second day of surgery. So we've conducted yesterday 29 cases and today 31. And we've got 5 days of surgery planned. So in total, we're hoping to do about 150 patients. That's ranging from smaller kids up to adults.
Now, how many are you planning to treat in total?
150. We've only got 5 days of surgery. We've got actually 6 theatre tables that we run more or less 12 hours per day on the 6 tables. And in total, we're hoping to do around 150. There were just under 250 patients that we screened that could actually possibly require surgery. And from those, about 150 will be done.
Now, I mentioned earlier that you guys were in the DRC not so long ago. Clefts are very common. How is the situation like in Malawi specifically?
Yeah, clefts are extremely common. It's almost every 1 in every 1,000 babies are born with this defect. And unfortunately, it doesn't choose any country or race, so it's actually everywhere. It's definitely a common problem in Malawi as well.
Cultural beliefs about cleft lip or palate can harm patients even after surgical repair. What are some of the mechanisms that you have in place to deal with this?
Yeah, we really try and educate the local community as well. That it's something that can be repaired, and it can happen to everybody, as I mentioned. So, cultural belief is definitely a problem. We actually see quite often in the questionnaires that we complete beforehand, that we do with every patient, that there's some beliefs that it's like children believe that they can be bewitched, and so cultural belief is definitely a problem. But we try and involve the local volunteers as well. So Operation Smile is not just a quick in and out. We actually try and educate the local people and the local medical staff and local medical volunteers about the correct information of clefts and how to handle it when we're not there.
Now, this is the second mission in just a few weeks. Are we going to see more of these missions across the continent?
Yeah, I'm actually very excited because there's one in South Africa that's happening in September. I think 24th of September. It's going to be happening in Bombela. And in between that one, there's another one scheduled for Madagascar. So, yeah, we're actually quite active and quite involved in quite a few African countries. So just following this one, Madagascar, and then Bombela in South Africa. So if there's any patients and any people, especially from South Africa, listening, please get in contact with us. If you know about anybody that's got a cleft lip, a cleft palate, we're there to help.
Now, Marius, you are a volunteer dentist for this project. Take us through your job specifically.
Yes, for me it's fantastic, to be part of a great organization like Operation Smile. You honestly make such a big difference in a person's life. I mean, it takes us about 45 minutes to an hour to repair a cleft, and you actually change that whole life of that, not only that kid, but also the parents. We had to hide that kid away and sometimes teach them to walk with their hand in front of their mouth just to have a normal kid. But more specifically for the dentist part, we do extractions. We do extractions in theatre of teeth that's got abscesses and a risk of infection and can complicate the procedure that the surgeons do. And the other thing that we do is also obturators. Now, many times the surgeons will just repair the lip, and then the patient will still have an open cavity, between the sinuses and the mouth, where any food and any drink can go in. So we make an obturator that actually close that area, so that no food and no drink can go in there.
Marius, just before we wrap up, you mentioned earlier that people can contact you if they know a child with a cleft lip. Where exactly can they get a hold of you? Now,
the easiest way is just put in any search engine, Operation Smile South Africa, and there's also a lot of details about how to volunteer if you want to be a medical volunteer, and even non-medical volunteers. We also have people that take photographs, do medical records, and so on. And of course, if you know of any patient or anybody that needs cleft treatment, even if they had cleft treatment in the past and they still possibly need a cleft repair, like a lip was done in the past and they need a palate, they can contact our Cape Town office. I'll give you the number if you want to have that.
Yes, please.
It's 021 447 3608. 021 447 3608, or as I say, just put any search engine Operation Smile South Africa, You'll get all the details on there.
We'll have to leave it there, Marius. Thank you very much for joining us on the News at 8.